just said, like, I'm going to give you a little bit of a rundown of what is happening, or pretty much already aware of what's going on, and then I'm just going to go a little bit into deeper topics. If you have any questions, let me know, interrupt me at any time. Because there are going to be some words that are long, complicated, I will try to break it down, hopefully find the right names that people might use outside of the medical system. And yeah, like I said, if you have questions, just let me know. A little bit about myself, why I know these things and where I get this information from. So like I said, I work for Fraser Health. I'm the drug checking lead for Fraser Health. So between Burnaby to Boston Bar, everything that has anything to do with drug checking is basically my baby. And I'm connected with the provincial and the national government to kind of get information about drug trends anywhere in the country and the province. Yeah, that's how I get all that information and kind of see drug trends emerging really early on. And yeah, so you're probably familiar that heroin is not really a thing on the street anymore. We have fentanyl because it is cheaper to make, it's easier to make, it is more potent, so you don't have to make as much, and you can cut it down to a lot. So it has all these basically economically positive effects for people, but because it is so potent, it can have negative outcomes for people because it is very hard to dose. And the problem is that if you get down, you don't know what the fentanyl concentration is very often. So in the lower mainland here, usually if you get down, the fentanyl concentration is between 5 to 20%. But really often we see it even up to 60%. And that is with fentanyl, it makes a big difference. But fentanyl is not the only thing that is in the supply. Nowadays, around 50% of the down here in BC is mixed with benzodiazepines. Benzodiazepines, there's so many different ones that are popping up. That doesn't mean one benzo equals the other benzo. There are a lot of, they have different onsets of action. They do sometimes a little bit different things in the body. Their dosage varies a lot, and then also the duration. So some benzos are active only for 8 hours. There are other that are active for 40 hours. So that just gives you a little bit of an idea. Sometimes people say oh, I'm very familiar with benzos, I'm totally fine, and then they get knocked out and they're wondering why, and it is a benzo that is just so potent in the micrograms, and they're just not used to that. But fentanyl, benzos, they're also not the only things that are happening, and I'm going to give you a little bit of information about that. But before I go into that, you might have seen pharmaceutical opioids being sold, given out, traded, whatever you want to call it, on the streets. The thing is with pharmaceutical opioids, if you get them on the street, that means they're unregulated. It's not that you go to a pharmacy and you kind of get the guarantee where it comes from. There's no quality control. And the most pharmaceutical opioids that you can get outside of the pharmacy are not real ones, they're fake. It started pretty early on, already in 2014, when fentanyl made its presence pretty clear as well. From that time on, also counterfeit opioids, pharmaceutical opioids were encountered. The first ones were basically the picture here on the bottom, the Oxy 80s. They were the first one that popped up. We don't see them that often anymore because they are pretty hard to fake. The ones from Purdue, they have a coating and the inside is white. I haven't seen a counterfeit one that looks like that. Oftentimes the color is off, they're really dark green, they're completely colored through, things like that. But just from looking at a pill, you don't actually know if it's real or fake. People can make really good fake ones. that's like the top picture here, like the Percocets. Those are really good nowadays. At first, like we encountered that it was just like a filler. Oftentimes, it's like microcrystalline cellulose is often used, and then instead of oxycodone, fentanyl is used, which wouldn't be such a big problem if the dosage would be equivalent to like 5 milligrams of oxycodone, but because fentanyl is so potent, it's really hard to dose it correctly. So a lot of people that are used to Percocets, to these 5 milligrams of oxycodone, and then get like fentanyl, and it's like a higher dosage compared, it can be harmful potentially. And a lot of people then started to, because Percocets are like, it's oxycodone and acetaminophen. Acetaminophen has a very strong, distinctive flavor, so people started to basically break pills apart and lick it, and I was like, okay, this is a real one. Nowadays, the counterfeit ones have acetaminophen in them as well, so like you can't distinguish the taste. And you can see the pictures here also on the top, but they look very, very similar to each other, so it's basically impossible to distinguish. And the same is now like what's happening since 1 or 2 years. The 20 milligrams of oxy, like the football-shaped ones. I haven't come across a real one in a while, which doesn't mean anything. I only see like a little tiny little percentage of what's actually going on out there. But most of the time, these counterfeit pharmaceutical opioids contain fentanyl. We've seen it sometimes mixed in with benzos as well, but usually it's fentanyl. And the only way to find this out is with test strips. Like fentanyl test strips are given out to the public, so you can check your own. Or you go to like locations where they offer the drug checking with the infrared spectrometer, which is here in Surrey. It's Wednesdays at SafePoint, or Tuesdays and Fridays at Foxglove, where you can access it. But unfortunately, fentanyl, or like family members of fentanyl, are not the only ones that are making its way into the counterfeit pharmaceutical opioids. What we see lately is counterfeit hydromorphone pills, and surprisingly, it's not fentanyl that is used in these. It is a different class of opioids, synthetic opioids, and these are basically called like nitazenes. I don't know if you have heard about that. It's again like a big family of different substances, all vary in potency. Most of them are a lot more potent than fentanyl, and they don't react with the fentanyl test strips. So even if you like check your pharmaceutical opioids with the fentanyl test strip, it comes back negative, it might be one of these nitazenes that is popping up. And these like Dilaudid that you can see, like the triangle of the 8 milligrams of hydromorphone pills, often prescribed as a safer supply. Now that like there's like attention to it, people started to fake them, and they're coming into the supply. And like I said here, like between 2018 and 2022, no counterfeit hydromorphone pills have been encountered, which doesn't mean like before 2018 there were none, but in 2018 they started to monitor it at Health Canada, so that's like the only data we have. But since late 2023, the counterfeit ones are popping up. Interior Health, which is everything east from Boston Bard until like Alberta, and they actually sent out a public health alert in November 2023 because they came across counterfeit hydromorphone pills that contain isotonitazene. Long word, just remember nitazenes or nitazenes. It's good enough, and this one is more potent than fentanyl, to give you a little bit of an idea. The same happened here in Vancouver Coastal Health, which is like west from Burnaby. In March this year, they alerted on counterfeit pills as well, and at that time they contained a different kind of nitazene. Just like to give you an idea that there are like so many different ones out there, and basically people are just constantly interchanging them. This time it was protonidazine and metonidazine. Again, nitazene, just like to keep it as easy as possible. Any questions so far? Like I know I'm just like shooting a lot of information at you. Yeah.
The drug testing place in 800 block East Hastings, do you get any stats? Are they showing up more and more?
They are showing up more and more, but it's still like a really, really small percentage as far as we can see. But given that not everyone accesses drug checking sites, and the one like Get Your Drugs Tested on East Hastings is like one of like the busiest sites in BC, so usually they get to see trends first. But we only see like a really small percentage of what is actually out and about. And we don't see as many yet, but it's just like it's concerning. Like I said, a lot of people test their counterfeit pill, or like the pharmaceutical pills with fentanyl testers, because they think fentanyl is the only substance that might be mixed in, other than like the actual substance that they expect, like oxycodone or hydromorphone.
I have a question.
Yeah.
Do they test the urine and blood of dead people for nitazines?
They can. It is not.
It's not routinely done? Because you won't find it if you're not looking for it, right?
No, it's
Okay.
not like routinely done. Also, like not in the hospital. It is really. Yeah, we talked about it. Like that, the response of the medical system is always really, really slow. So we're like kind of trying to get like.
Well, that's the coroner I'm talking about then, right? Really?
Yeah, they
okay.
look for it, but it's yeah.
Okay.
I think they just started. So like, who knows what the data is from like a couple of years ago.
Can I just ask something? You might go into it further on, but what exactly, it's an adulterant now, but what is actually nitazene? Is it just its own thing? Is it it's not benzo, or is it?
No, it is an
Okay.
opioid. It's a synthetic
Okay.
opioid. It's comparable to fentanyl, but it's different. So like fentanyl
Okay.
is like its own family of like 1,400 members.
Right.
Nitazines have like also like around that amount of family members. So it's just like both like really, really potent families of opioids, but not really, really good. They just, yeah?
Just out of curiosity, why would they need to use testing for that though?
Huh?
Like what Anna was mentioning, why would you?
I just asked if they, when you're dead, do they check you for them? And she's saying it's slow, but they're starting to.
Yeah, normally well, from the experience that I've seen, because I was a coroner, not the guy that does dead body thing and the checkups. It's actually it's a special name for that person, but
The
they normally
deceased?
just test the heart, like the weight, if there was anything abnormal. All they test is just abnormalities.
That's just like something different. Like from like the weight of the organs, you can't really determine if like toxins or like other substances were in your body. It's just like with your blood or your urine, or like sometimes like even like tissue samples,
Yeah,
they
I've seen
can
that.
then like find if they were like substances that don't belong into the body on a like usual
And the only time
basis.
they do that is if they suspect there's something wrong. Otherwise,
The
they-
autopsy, yeah, like they don't do many. Like often it's really just like a tox screen to
maybe it's a murder, suicide, something suspicious.
yeah, like if it's suspicious, they look into it. But if it like seems like someone was using a load and overdosed, they only do like a tox screen to see what was the cause of it. They don't usually do like a full-on autopsy. That's right. Okay, so back to this.
Sorry.
This is another nitazene with a really, really long name, N-pyridino protonidazine, or the short version, protonidazepine. This has been detected in Quebec City back in February, and it was detected in counterfeit pharmaceutical opioids, not the Oxy 80s like shown here, that was just like shown in the media. They just probably just grabbed a picture and like went with it. But actually it was found in these little blue pills. We don't see them as often here in Canada. They're really, really common in the US. So that was like a little bit surprising that we saw it here. But usually like in the east of Canada, because it is pretty close to like the big cities like New York, Philadelphia, Detroit, Chicago, they get a lot like of the supply that comes in.
Say it again.
US.
What is that stuff? The limb on it?
Morphine pills. I believe.
Oh, morphine pills.
Yeah.
Okay, good. So it's in fake morphine pills.
Yeah,
Okay, got
fake
it.
Morphine pills. And they're like, yeah, it's like a given now basically in the US that these are fentanyl pills. But in this case, in Quebec, they actually found like the protonidazine derivative. And this has been found for the first time in 2023 in Canada. Just to give you an idea that it has been around for a little while, but it is a very new, like, synthetic opioid that is entering the market, and it's entering it worldwide. Europe was lucky enough for the last 10 years that the heroin supply was good. It was good quality, it was cheap. So there was no need for synthetic opioids. The Taliban in Afghanistan, Iran, and Iraq, who are controlling the poppy production, which is which is needed to produce heroin, they cut it down by 90% in the last year. So now synthetic opioids are entering the market in Europe. I don't know if you heard, like Scotland, their death rate is skyrocketing. And surprisingly, it's not fentanyl that is entering the market, it's nitazines. And the same in Australia. So like I'm actually gonna be on like a discussion panel tonight that is with Australia to get some more information where this is coming from, because fentanyl is nowadays produced within Canada. It's not that it comes from overseas or from the US, but nitazines, we just don't know where they come from.
Yeah, so nalazine is also a drink.
Yeah,
Now, what kind of drink is nalazine?
it's
It's
an
not.
opioid.
It's an opioid.
Yeah.
We're gonna get into trank and benzos pretty soon.
Tell the difference, because nitazine and xylazine sound the same. and
Yeah.
So they're not.
I know.
the
They're
same.
not related,
Yeah.
not related at all. Yeah. Okay. In this case, this is actually up to 25 times more potent, so like stronger than fentanyl. So if you find this in pills, it is a very, very strong pill. And like I said, like this is supposed to be a morphine pill, not comparable to like something that is 25 times stronger than fentanyl. So these are still opioids. So naloxone still works. You might need quite a bit more though, because they're like so strong that they like attach to the opioid receptors in your brain like really strongly, and you need a lot of naloxone to kick it off. So you might notice that like people need like 5, 6, 7 dosages of naloxone until they finally start breathing again. And that could be like because these other synthetic opioids are in the market right now. So this is something because we just talked about xylazine. Xylazine, often called trank, is in the supply since 2012 actually. It's nothing new. It hasn't been monitored by Health Canada though, so that's why it like suddenly pops up in the media. Everyone is talking about it. It is not that common. It's around like 5% of the down supply has it, but it is definitely picking up because xylazine is not an opioid. It's its own like family of sedative. It is only used like for veterinary care. It's not for humans. yeah, like if you use it and you like, let's say like you buy your ounce or whatever, and you use it for 2 days and then you lose it, you sell it, you give it away, whatever, you smoked it all, and then you get a different kind of supply and it doesn't contain xylazine, you go into withdrawal immediately after just using it for 48 hours. And the first sign of withdrawal is anxiety, severe anxiety, and there's nothing really that can be done to like treat this anxiety. In the hospital, they would give you benzos. Yeah, it's not great, and like there is an antidote for it, but it's also like again only for animals. So it's not really that we can just like take it and use it for humans. So it is a little bit tricky. Xylazine is like very sedating. So like oftentimes it is in combination with fentanyl and benzos. So like you have 3 different kinds of depressants, which is not great for your respiratory system. And xylazine also slows down your heart rate and your blood pressure drops. So it is not great. And the long-term effect is that you probably heard about that people say they get like wounds that won't heal. So xylazine restricts your blood vessels. So that means like, especially arms and legs, the skin doesn't get like the blood flow that needs to kind of, if you have like small injuries, to like get like your blood platelets and your antibodies to those places to kind of like start the healing process. So then you get infections. Still like no healing is happening, and these infections are really just like festering if you keep using xylazine, because the blood vessels are just constantly restricted. And that's like where like these big wounds can come from. They can also come from like just normal infections, and someone has like their immune system is not working so well. Like it can happen too. Like not every wound is caused by xylazine, but there's definitely a correlation between xylazine and wound forming.
Can you get a heart attack?
Yeah. Yeah. That's like, or it's like it stops basically. It's not like a heart attack, but your heart can stop from xylazine. So, because there's more and more stuff getting mixed into the supply, xylazine is not the only thing right now. So there's something new that is popping up called medetomidine, or sometimes also referred to as dexmedetomidine. Same family as xylazine, stronger, lot stronger, longer lasting. We see it quite a bit in Surrey and Abbotsford and Chilliwack and Mission. Those are like the areas where we see it. It is picking up really fast. Faster than xylazine, to be honest. The good thing about medetomidine is it is approved for use in humans, so it is less toxic, but because it is so potent, and also like people don't really get the dosage right, it is like heavily sedating, and it has also the effect again on your heart. So you might come across some overdoses where the heart stops, and CPR needs to be given, and it's gonna be more and more common because this is definitely in the supply. It's still like under 5% of what we see, but because it is picking up so quickly, it is a concern. The thing is also because it is so potent that really often like the point of care drug checking sites where they have the infrared spectrometer might not be able to detect it because it's just like in concentrations below the detection limit. It's still really active in your body though. Yeah, and this was like found in Toronto first. Like I said, really often like drug trends like start in the east and then make its way over here. But it's definitely here as well. And yeah, like this is just giving like a little bit of information that I already gave you, that it's like longer lasting and stronger than xylazine. It is used as a sedative and muscle relaxant in veterinary and human care. So like when animals and humans get surgery, it's used. Because it is a muscle relaxant, you might pee or poo yourself. So like if like people might complain, it's like, I don't know what is happening with me. It might be one of like these muscle relaxants that are happening. And like I said, with xylazine, using it for 48 hours and then stopping puts you in withdrawal. With medetomidine, it's only 24 hours.
And how long does the withdrawal last? And is it dangerous? It's just
It's
anxiety?
It's not dangerous.
Okay.
Especially like after such a short amount of time. And it doesn't last super long. But no one wants to deal with anxiety.
No, of course.
And that's like the only thing that right now people report, because like I said, usually xylazine or medetomidine is in combination with fentanyl and benzos. So we don't actually really know what exactly the withdrawal effect might be, without like taking all the other substances in consideration. And like with other substances that are mixed into the supply, this is not just put into like because people are evil or like whatever. It's just they want to like enhance the effect of fentanyl. Like people are complaining that fentanyl has no legs, and they just want to increase the duration of fentanyl. The same like with benzos, the same like with other things that like have shown up. It's always that they kind of like try to enhance the effect of fentanyl. But these substances are really often, not approved for human use. Okay, I think that's it from my side. Does anyone have any questions?
Do you have a slide on benzos?
I don't have a slide on benzos.
Can you make a comment about benzo withdrawal from these short-acting benzodiazepine-like substances?
Withdrawal from benzodiazepines can be dangerous. Like with opioids, you can stop like cold turkey. It is bad. It's really bad. But the withdrawal is not usually causing death. With benzodiazepines, you can't just stop cold turkey. The withdrawals can be so taxing on your body that like strokes, heart attacks, seizures, all these things can happen, which can then lead to death. So if you want to like taper down off your benzos, you have to do it really, really slowly to avoid these side effects. It is tricky because a lot of doctors don't even account benzodiazepines at the moment when they try to taper down patients. So it is complicated, and I hope that like eventually we're gonna pick up on that. But with benzos, don't just stop. Like really, really small steps to taper down, because seizures are definitely a possibility. I always get questions about like seizures because we see it more and more often in people that use drugs. It's not always a benzo withdrawal that causes it. It's also like we don't actually know what fentanyl does to the body if you use it for a long time. It is a medication. It is a very important medication for people, but it's only used like short term, or like for basically cancer patients. So we don't know like if you use it every day for 2 years, what it does to the body. Then oftentimes people have overdoses where like the brain doesn't get like enough oxygen, which definitely causes some injuries to the brain, and that can cause seizures. So like there's so many different factors to it. And also like what we now expect is that xylazine causes seizures as well. So there's like a lot of different substances that can like
Can I ask
lead to
another
this.
question?
Yeah, of course.
With the drug checking, we just have a smattering of whatever shows up somewhere to get checked, and we have no way of really knowing, like a scientific kind of collection of data,
To
and then have
predict
some
it?
sense. No, just saying, well, right now we know the drugs in Surrey are blah, or
Yeah.
the drugs in Nanaimo or blah,
Yeah.
or the drug, you know what I mean? So is anyone working on that, or is it just, it seems like if we get enough samples, you do that kind of statistical thing, right?
We definitely look for it. Like the BCCSU, like the BC Center on Substance Use, is collecting all the data from the point of care drug checking side
Okay.
with the infrared spectrometer within BC, the Yukon, and Alberta, and they actually send out a monthly report
Okay,
on like what they see, and they also like every monthly report is also like separated in health authorities to kind of like narrow it down a little bit more.
because the other problem that we're always up against is this very political, bizarre headline-seeking hysteria, and they'll say it's diverted supply, and I think, but how do you know it's not those fake dillies? Do you have any sense of how careful anyone is, and the police labs or versus the BC CDC labs, or
So
because this is it's a very difficult fight that we have, because they'll just say they seized 6,000 dillies,
Yeah.
which
So-
I could believe you could get that many if you really saved them up, but I'm just saying, how do we know they're not fake? And we always want to say to the police, what did you check and see if they're not really the fake dillies? You know what I mean?
it's like the police go through Health Canada
Okay.
to test their supply, and yes, hydromorphone and fentanyl or like the nitazines are like completely different. They can definitely differentiate between those things, but oftentimes they test positive for fentanyl, and the technology that they have at Health Canada is like so sensitive that they can pick up fentanyl, and it might be just on the outside, that it's cross-contamination. So that usually it says like, oh, we can't tell if it's like the active ingredient within the pill or if it got in contact with fentanyl on the outside. But if it's a real one, hydromorphone should definitely be detected. There is definitely some diversion happening, because
yeah.
we know that like say for supply, like hydromorphone for someone who
No
has
one
a-
wants hydromorphone.
It's
That's
not
why they get
working.
rid of it. Yeah,
And
It's
if
not
people
working.
got what they needed, then they wouldn't be
diverting it.
And
of course.
it's still harm reduction.
And then, do you have any comment on what's contaminating stimulants, or whether, you know what I mean? Just a quick comment.
Oh, sure. So stimulants, cocaine and methamphetamine and like crack cocaine. Honestly, like the methamphetamine quality is really, really good, because the market is flooded. So the quality has to be good that you can actually push the product. The thing is, sometimes we see cross-contamination in the methamphetamine. Like methamphetamine is the one stimulant that is cross-contaminated with fentanyl the most. It is still like a really small concentration, but it is that like people distribute both fentanyl and meth. They don't clean their fucking scales. Like, sorry, my language, but they think, oh, it's like barely, like you can barely see it, but like for someone who has no tolerance to any opioids, 2 milligrams of fentanyl is deadly. That's like not much. So it's like, tell people to clean their scales, not to reuse tools, not to reuse baggies, don't share pipes, because like, yeah, for one person who has a tolerance to opioids, it's totally fine, but who doesn't, it's not fine. So that's like happening sometimes. It's really not often, but it's still like definitely education to people, because they just don't realize how potent it is.
So keep alcohol swabs nearby
Yeah,
and
yeah.
wipe everything
Alcohol
down.
swabs, don't share pipes, like they're giving out for free everywhere. And don't like maybe like someone says, oh, it's fine, like just use my pipe, like just don't have your own, just have your own, to be on the safer side. Yeah, do you
Oh,
have?
I didn't want to interrupt, because that's
Oh.
really important, I didn't want to interrupt that.
Oh.
Were you done? Okay. I just had a quick question about, my roommate, works at Foxlab in the peer witness room, and he was just telling me, about something I wanted to ask you. Is there anything, or have you heard anything specific to be traced back to an overdose presenting with like immediate and really, really extreme rigidity?
Yeah, so like the rigidity, like the wooden chest, some people call it, or like, yeah.
It's almost like a rigor mortis thing.
That's been
It's-
happening for a couple of years.
It's,
Is it, eh?
yeah,
Okay,
like it
maybe
has
I'm
been,
just hearing
like,
about it,
and
okay.
people think has something to do with fentanyl,
Okay.
but we don't know.
Okay.
We just
okay,
don't
okay, I didn't
know.
realize it
Oh,
was
yeah,
been so
it's been
long.
years.
Yeah.
I just heard
Like
about that.
since
Okay.
20.
And like we just don't know like if you have like micro injuries to your brain because you had like smaller overdoses where like your
Right,
brain
yeah,
had
that-
like no oxygen, what eventually happens. So
I thought it might have been traced back to something specific, but I guess not.
like fentanyl is like definitely something that is like where the correlation is.
Right.
I don't know if like all these other substances are like adding on to that.
Okay.
Yeah. Like there are no studies done. That's
Right.
the thing.
I
like
guess this is just
like
trial by
we're all the
fire.
guinea pigs right now and
6 o'clock.
yeah. So did I answer all the questions?
Yes, you did.
Okay.
So
Awesome.
we should give her a round of applause.
Woo!